So Scott, you've been in Medicare supplement world for a long time, and I know you know a lot about it, but a lot of people don't. So there's Part A and B and C, D, E. It seems like there's a bunch of them. Tell me, what is Medicare?
So the two main parts to Medicare are Part A and Part B. Part A is the hospital side of Medicare, and then you have Part B, which are the doctors and the clinics. That's what you pay for on a monthly basis. And this year, the premium for that is $170 a year, and that changes every year. And then you have Part D, and Part D is your prescription drug plans. Then Part C, which is Medicare Advantage, which is called Part C by some. Those are your Medicare Advantage plans. And then you have Medicare supplement plans, or Medigap, it sometimes is called. So those are your basic parts to Medicare.
Tell me, what is Part D in Medicare? What does that cover?
So Part D covers your prescription drug plans. So, everyone has to take out a prescription drug plan either through a standalone drug plan or with a Medicare Advantage plan. Many of the Medicare Advantage plans include a prescription drug plan.
So Scott, what is Medicare Advantage, and should I sign up for that?
A Medicare Advantage is managed by private companies. So basically, your Part A Medicare and your Part B are incorporated into a policy that is taken over by companies like United Healthcare and Aetna and Humana. And those policies usually have a higher deductible, they have higher copays or more copays, and they also have a network. And network is the network of doctors and hospitals is what causes problems for most people, especially if they're younger in retirement and they're traveling some. If they get outside of their network, they either have no coverage or they have a much higher copay or out-of-pocket cost.
So what is a Medigap or Medicare supplement plan?
So Medicare supplement is your original Medicare, Part A and Part B, and then you have Medicare supplement or a Medigap policy, which will cover everything that Part A and Part B do not cover. There are a variety of Medicare supplement policies or plans. We recommend Plan G to most people. Plan G, the only thing that you have out of pocket with that type of Medicare supplement plan is a $233 deductible.
And what are the differences then between a Medicare supplement plan and a Medicare Advantage plan?
So one of the biggest reasons that people go with a Medicare supplement versus a Medicare Advantage plan is that Medicare supplement has no network of doctors or hospitals. So you can go to any hospital or any doctor that you want to, or any specialist. And if there's no network, so if you're traveling to other states or other parts of the country, then it's covered, and you don't have to worry about the doctor or hospitals. So that's one of the biggest differences. There's also a much higher out-of-pocket cost on a Medicare Advantage versus a Medicare supplement, most Medicare supplement policies.
So why would I do a Medicare Advantage? Just for cost savings?
Medicare Advantage a lot of times will, so for instance, maybe somebody's later on in their life, they're not traveling as much. so they're staying more towards their network of doctors and hospitals, and also they include some extras like dental coverage, and the prescription drug plans are included in a Medicare Advantage plan, where with a Medicare supplement you have to take out a separate Part D prescription drug plan.
How do I know which Medicare supplement plan is best for me?
So we're going to sit down with each client and we're going to talk about different things as far as how much are you going to travel, how much you're going to be traveling in retirement. And as we know, a lot of people, that's what they do, at least the first 10-ish years maybe, is they spend a lot of time traveling. So if you're traveling a lot, then a Medicare supplement is probably a better way to go, because you don't have a network of doctors or hospitals. With a Medicare Advantage, you're going to have a network where if you travel outside that network, you're either going to have no coverage, or you're going to, at the very least, going to pay a higher out-of-pocket cost. So that's the biggest difference. But we're going to sit down. We're going to talk about those things. We're going to and are you comfortable with the higher out-of-pocket cost than a Medicare Advantage policy, most Medicare Advantage policies have?
So what is the cost difference between a Medicare supplement plan and Medicare Advantage?
Yep, so that's a great question. The Medicare supplement is going to be more, it's going to cost you more per month than a Medicare Advantage. Most Medicare Advantage plans are zero premium per month. They don't cost you anything. Now, I say that the plan itself doesn't cost you anything, but you still will pay your Part B Medicare. On a Medicare supplement plan, you're going to pay anywhere from probably $120 to $200 a month per month on a Medicare supplement plan. And that's the reason many people go with the Advantage plan is the cost per month is much cheaper or zero.
Can I switch plans over time?
So if you go with a Medicare Advantage when you first become available, where you can start Medicare, if you go with a Medicare Advantage plan, then you have 12 months from that time period, from when you start. You have 12 months to decide if you want to stay with that Medicare Advantage, and then you have an option to automatically go back or go to a Medicare supplement policy. If you decide not to do that within that 12 month, then you would have to qualify. And what I mean by qualify is if your health is still good and you don't have something that would keep you from qualifying, then you can go to a Medicare supplement, but you would have to qualify after that 12 months. So that is another reason that people go with a Medicare supplement at first, especially if they have some health reasons, because during your initial enrollment, when you turn 65 or when you retire from your employment or your employee health insurance plan, then you have a window of time that you automatically qualify for whatever plan you choose.